From the earliest years of her reign to the more recent, this is the Queen we've become used to seeing. Active, available, and in very good health. As recently as last year, despite the persistence of a pandemic, she maintained a packed schedule. In the space of just a few weeks in October, she opened parliaments in Scotland and Wales, planted trees in Balmoral, and launched the Commonwealth Baton Relay in Buckingham Palace. But shortly after, there were signs the schedule was taking its toll. She was seen using a walking stick for the first time at a major public event, a Royal British Legion service in Westminster Abbey. And after a night in hospital, she was advised to take it easy. Her family stood in for her on Remembrance Day, a scheduled speech at COP26, delivered remotely.
We are privileged to bring this latest camera record of their Royal Highnesses with their baby son, Prince Charles of Edinburgh, now 8 months old.
But in her 95 years, she has barely ever been ill. She battled measles when Prince Charles was a baby, meaning she couldn't see him for a period. But the first time she was ever admitted to hospital wasn't until the 80s, a wisdom tooth extraction, the same year she met Reagan. And other than surgery on her knees, she's hardly ever been back. Her previous most recent stay in 2013, a bout of gastroenteritis. The palace has been relatively tight-lipped over the years about the state of the Queen's health, but her work rate and general reluctance to take time away from her duties has in many ways spoken for itself. What we do know is that she's remained remarkably active well into her 90s, being seen, for example, during the pandemic, riding her horses in the grounds of Windsor Castle. Her love of this sport and these animals has no doubt helped keep her fit, as well as her team of world-class doctors. But this pandemic has targeted the elderly, even those triple jabbed. People may well feel worried, but doctors say she'll be well looked after.
Anyone who's at more serious risk of the impact of COVID-19 would be assessed by a healthcare professional. Their blood oxygen levels would be monitored, and if they were at risk of more serious disease, then they would be eligible and would probably receive treatment with the new antivirals or potentially antibody treatment that's now available. These are very effective treatments if given very early.
Throughout the pandemic, she's stuck tight to the rules, most powerfully, poignantly, at Prince Philip's funeral. Any thought she'd slow down in the wake of her loss clearly didn't come to pass. Instead, she's been led, as always, by duty, with a keen sense of humour in tow.
How's that?
Are you supposed to be looking as if you're enjoying it?
Yes.
She may feel, at least, this virus won't stop her. Helen-Ann Smith, Sky News, Windsor.